Dr. Piali Mondal. Yeah, please come. A rare case of iridocorneal endothelial syndrome managed by MF glaucoma valve implantation. वहाँ उधर चले जाओ.
Good morning, everyone. I'm Dr. Piali Mondal. A 45-year-old female presented with sudden onset pain and dimness of vision in right eye for 2 weeks, referred from Peripheral District Hospital. Dimness of vision in right eye for past 1 year, with sudden onset pain and deterioration of vision over 2 weeks. No complaint in the left eye. The past history, nothing was significant. In treatment history, the patient was on eye drop timolol, travoprost, dorzolamide, and ripasudil. Systemic examination, everything was within normal limit. On ocular examination, the visual acuity of right eye was 6 by 60, left eye was 6 by 6. In right eye, there was pupil polychoria, lid and agnexa was within normal limit. Conjunctiva was clear, cornea was edematous, as we can see in the picture. Iris was atrophied in the right eye, but within normal limit in left eye. Lens was clear. Fundus was, cup disc ratio was 0.8, while in the left eye, the cup disc ratio was 0.3. On IOP measurement, right eye was 28 mmHg, and in left eye, it was normal 16 mmHg. Gonioscopy, there was peripheral anterior synechia in all quadrants, but in left eye, there was open angle in all quadrants. On OCT RNFL examination, the right eye showed thinning of inferior neuroretinal rim. In left eye, there was no thinning revealed. Perimetry examination showed the right eye had a visual field defect. On specular microscopy, there was reduced endothelial count, high pleomorphism, polymegathism, loss of typical hexagonal shape of cells. The patient was diagnosed as a case of iridocorneal endothelial syndrome. The patient was admitted and started on intravenous mannitol infusion after completing the baseline investigations, that is FPS, PBBS, urea creatinine, and cardio fitness. The patient was planned for MF glaucoma valve implantation surgery. Post-operative management, on post-op day 1, the visual acuity of right eye was 6 by 60. The IOP was slightly lowered to 22 mmHg. The patient was given on topical and oral antibiotics, cycloplegic, topical and oral steroids. On post-op day 1, the visual acuity of right eye was 6 by 60, and the IOP became even more lowered to 18 mmHg. Thank you.
Yeah, thank you, Dr. Piali. Could you have managed the case in a different way? Like I saw the case, the tube was in the anterior chamber. Was the chamber depth sufficient?
So when the patient first presented to us, that time the patient only had blurring of vision. So that time we managed the patient with only medical management. But after 2 to 3 weeks, the patient again presented to us with, and in the first visit, we did all the investigations. But after 2 to 3 weeks, the patient again presented with the deterioration of vision and mild pain. So at that time, we thought that implantation surgery would be the best one.
No, like what was the scope of iridocorneal adhesions? Was it 360 degrees or was it?
So it was around 3 quadrants total, not total 360.
Yeah, what I want to ask is, I saw the tube in the anterior chamber. Was the depth sufficient for the tube to be placed in the anterior chamber? Is there not a risk of that? I saw the tube a little bit long also, touching the endothelium and causing corneal issues later on.
But that thing we could not find in the subsequent visits. The depth was within normal. It was sufficient.
Okay, okay. Thank you.
Thank you, sir.
Nice presentation.
Thank you, sir.